Hi, I'm Dr. Charles Shinaver. Welcome to Fit Families TV. Today we're here with Ashley, who's a college student. Ashley, what year are you in school?
I'm a senior.
Okay, so you've been on campus for a while.
Yeah, I've had almost 4 years of college on-campus experience.
Okay, one of the questions that's been on my mind lately since we've been talking about the abuse of ADHD medicine on college campuses is I haven't been in school for a long time, so maybe as a parent and a psychologist I'm making a bigger deal out of this than what it actually is. So I was wondering from a college student's point of view, is the abuse of ADHD medications a big deal?
It really is. You're not making a big deal out of it, I don't believe. It's kind of funny because when I begin to think about it, it's really kind of like, I think of it as an underground business almost, because on the surface you really don't notice what's going on if you don't really pay attention or ask people or talk about it. And when I started to ask some of my friends about it who are on ADHD medications and ask them about, are you ever asked to sell your meds or give your meds to friends or and whatnot? And one of my friends, Jill, she was embarrassed, but she told me, I'm asked all the time to sell or to give, my medications away. So really you're not making a big deal of it. It's a huge deal. And a lot of my other friends that I've talked to, same thing. People are asking for them all the time.
So it's actually kind of a black market on college campuses to sell ADHD meds.
It's weird to say that, but it really is. And it's kind of disturbing in a way because you think, that's not something that should happen. And I don't know, it's just kind of weird to think of it that way, but yeah, you're right.
One of the issues that seems confusing to me is that the line between use and abuse seems blurry because so many kids are prescribed this medication by physicians, and because physicians prescribe it, people seem to think, well, it's not that big a deal, a lot of people take it. So it seems like there's a tendency to underestimate how powerful these drugs are. Do you think that's accurate?
I do, and it makes sense that people would underestimate that, the powerfulness of the drugs, because you're right, physicians do easily prescribe the medications. I was talking to a few friends honestly last week, and someone said, I think I have ADHD, what do I do? And another one of my friends turned to him and said, oh, you just go to a physician and just tell them that you're nervous all the time and you can't study and you're always anxious, and they'll just prescribe you Adderall or something like that. And I was shocked. I couldn't believe it, because they're right, it's true. And because someone thinks that a doctor will so easily prescribe the medication, it must not be a huge deal to take it. And then, therefore, it must not be a huge deal to give it away if someone wants it.
So it's almost like there's this issue of it's pretty easy to sort of almost fake a diagnosis for ADHD and go to a physician and get a prescription as long as you know the right things to say.
Exactly. And it's easy to do. I've had so many friends tell me that same thing, that you can just easily get them.
The other thought that I have about it is it seems like there's this continuum of soft drinks, coffee, tea, energy drinks, and then ADHD meds. And it seems like there isn't a line between all these things. And from my point of view, it seems like there should be this huge, big line between all these over-the-counter things that are legal and ADHD medications. And it should say, we should say pick-me-ups for the first set of lines, and then for the second set of products, you say lock-me-ups, because if you're using them, and you aren't prescribed, that's what's going to happen. The other issue for me is that it brings up the importance of having alternatives to just ADHD meds. Do you think that the fact that this is such a problem on campuses suggests that there's a need for alternatives to increase attention other than just taking a pill?
I definitely would agree with that idea, just because you're right with the difference between the pick-me-ups and the lock-me-ups. There should be a huge clear line, and there's not. So if we can put more in the pick-me-up category before people have to go and, get prescribed for medications, that would make things a lot healthier and a lot more clean-cut. I think if we had that, maybe students would begin to realize that there really is a difference between taking a medication that's prescribed for you and being able to do some sort of activity or some other treatment that's not medication that you don't need a prescription for, but anyone could use and could benefit people with ADHD.
Absolutely. Thanks, Ashley. Appreciate it.
Yep.
This is Fit Families TV, Dr. Charles Shinaver.